Hey, I'm Dr. David Crozy with Compass Chiropractic, and I'm going to share with you a couple quick tips to cycle without pain. Here's the first one. Don't jam your joints or stretch your facets. On the back of your spine, you have 50 facet joints. The facets are the inner surfaces of these joints, and if you jam a joint backwards, or if you stretch the facet out for an extended period of time, swelling will develop. And then when you move it from that position, it'll squish these nerves and cause pain and symptoms in that area or where those nerves go to. If you bike in a poor position like this, the joints through the lower and upper back are fully flexed forward. Those facets are stretched out and swelling will develop. It would be a bit like if you spent a few hours like this and you'd have pain when you get out of that position for sure. At the same time, the joints in the upper neck are jammed all the way backward, just like if you did this for a couple hours. Pain for sure, right? So in order to reduce this, think about rocking your pelvis forward, moving your belly button toward the top tube so that your lower and upper back are lined up better. And then think about dropping the chin down a little bit so the joints in your neck aren't jammed together. If your bars seem too low to allow this, get in for a bike fit with local pros Adam Thompson, Ryan Blaine, or Jason Quinn. I'll share their info in the comments. Periodically while you ride, do some cat-cow pelvic tilt type motions to loosen those joints in the low and upper back. And in the neck, you can do a head retraction where you give yourself a double chin to stretch out some of those joints in the upper neck. Now let's talk about a couple top causes of pain in the spine that we see in our thorough workup. The first is degenerative or arthritic changes. On the left, you can see a normal spine. On the right, you can see some arthritic changes where the spaces between the bones are shorter and we can see bone spurs in around the edges. Here's one on the right in the low back. That's going to make swelling, pressure on nerves, pain and symptoms in that area or down an arm or a leg way more likely. This person is going to be way more likely to have hand and arm numbness because the nerves that control the arms exit in this area of the lower neck. As long as those changes aren't too severe, chiropractic care can help get those spots moving better, decrease the swelling and pressure on nerves, and have people out of pain and able to enjoy their rides. If we find that the changes are too severe though, sometimes there need to be major changes in the bike fit or even bike choice for a person to be able to cycle without pain. The second cause of pain are spots in the spine that I call healed but not healthy. What's that mean? I want you to imagine that I got my knee replaced, but then I skipped all the physical therapy, just laid there for 8 weeks with it totally straight. At the end of that time, it'd be healed, right? But it sure wouldn't be healthy. It'd be all seized up with scar tissue. And then if I got up and started trying to walk around, I'd end up with problems in my ankles, my hip, my low back. So spots that are healed but not healthy are spots in our body that have scar tissue not letting them move properly. So most cyclists with spine pain have some of these healed but not healthy scar tissue spots in their spine. There are a lot of things that can cause that scar tissue to form. So research done over at Yale found that a car accident with just an 8-mile-per-hour difference is enough to result in scar tissue. And so certainly any decent fall off a bike could probably put that amount of force into the spine. For other people, it's actually an accumulation of repetitive stresses, such as repeatedly heading the soccer ball if you play soccer, or having a job that had a lift and twist activity to it. Those repeated stress could still gradually injure tissues and result in scar tissue. So how do we find those scar tissue spots in the spine? A normal x-ray or MRI or CAT scan won't show it. We have to have the person move, and then we can instantly see what's working and what's not. Over here at Compass Chiropractic, we're able to do what's called a motion study, where in the neck, we have the person tilt the head all the way backward, get an image, and then one all the way forward. In the low back, we have the person bend to the side each direction and get an image, and we can see if the bones there are able to move or if some of them are truly stuck and seized up by that scar tissue. Here's an example normal motion study in the neck. On the left, the person is standing looking straight ahead, and on the right, they tilt their head all the way back, and you can see that each of the 8 bones in the neck each move a little bit backwards. We end up with this nice smooth curve the whole way up. Now look at this one. On the right, you can see that those bottom few bones don't tilt backwards at all. They're stuck And so all the movement of extending the neck goes to the top of the neck and is going to put a bunch of extra stress on that area. That will cause pain in the short term. But that scar tissue is also what ultimately leads to the arthritic and degenerative changes, which we said can cause their own set of problems. Once we know exactly what's working and what's not working, we can put together a super effective plan to restore motion into those spots that aren't working right. When we do that, we get excellent 5-star results. We get cyclists back to cycling without pain, full function down the legs, hands not going to sleep. And so if you've been putting up with these symptoms, we want you to click the link below or give us a call and ask to do an athlete's workup where we can check out how all your body is working, do that motion study, see if the bones are moving or are they stuck and seized up with scar tissue, and be able to give you our best recommendations to get you out there on the trails and road, feeling great, riding fast, living the dream.